Ladies and gentlemen, welcome to our conference. I'm standing before you all to introduce my teacher, Un Chong Kai, but he's younger than me. Dr. Wen is licensed in both Chinese and Western medicine, with his PhD from Chang'an University. He is president of the Taiwan Chinese Medicine Association and the vice president of the Chinese Medical Association of Taipei. In addition, Professor Wen frequently gives lectures and seminars in university and many medical societies globally, such as Japan, American, Canada, and Russia, and China. Many medical societies globally. He treats patients voluntarily all over Taiwan, such as offshore island Penghu, during his off hours on a regular basis. Dr. Wen has garnered international recognition in treating rare, incurable disease such as MLD, ALS, and many others by his own acupuncture method. Today, we are very honored to have Professor Wen to share with us on the topic of Wen's modern acupuncture in orthopedic clinical application. Thank you. Dr. Wen, please.
Thank you for the Dr. Wang's introduction. Actually, Dr. Wang is my teacher, and I work in 中国药学院附设医院be a resident of orthopedic department. He is my teacher. And he becomes my acupuncture student. It's very interesting. And he also is my best friend in my life. So thank you for your introduction. And thank you for the President Chen and you to invite me to be here. I want to share my acupuncture with you. I want to let you know how acupuncture can help the orthopedic patients. And I'm glad to hear the speech the professor from the Japan told us about locomotive syndrome. I think we have more than 80% patients in my clinic. They are all the problems with locomotive syndrome. So I think maybe you are interested in the acupuncture. Nobody can imagine before Kissinger went to mainland China. He said, who would have thought if you stick a needle into somebody, it will help him? No other civilization thought about that. Even in Asia, mainland China or Taiwan, I don't think everybody knows acupuncture, what it can do for the patient. But it does. First of all, I need to explain briefly about my acupuncture. My acupuncture is a kind of revolution or breakthrough from the traditional Chinese medicine. I use anatomy, physiology, pharmacology, neuroimmunology, etc. to combine with the traditional skill, needles, to do the acupuncture. That's my acupuncture, what I call Wen's acupuncture. Because of time limit, I cannot explain very detailed for this. I hope I got another chance to share with you more details about my acupuncture theory. So it's very different from the traditional meridians or traditional Chinese medical theory. It's not talking about the 12 meridian, lung meridian, kidney meridians. No, we don't think. I have another integration, so it's different. So even I use ancient skill, needle, but my theory is based upon Western medicine, Western medical theory. So it's an integration of modern medicine and traditional ancient skill. I have put my cases into 4 categories today. Number 1 is operative cases. It means the doctor does not consider to operation of patient due to the patient's physical condition. Something like this. When the patient is pregnant, we don't think it's a good indication for operation. But the patient suffers from hip pain and even cannot walk for more than 1 month since week 20 of her pregnancy. What can we do? If we give the patient analgesic painkiller, it's not so good for the patient. Okay. We use 碰到肌肉不能走路。Because the patient is pregnant, only 1 time of acupuncture. 现在感觉呢？可以吗？Yeah, the patient can feel much better. 剩一点点，多大点？哦，很好，很好。It's only 1 time of acupuncture. The patient say it's much better, more than 50%. And besides, she can walk normally. We don't use any drugs. Just 1, 2, 3, 4, 5, maybe 4 needles. That's the way we do for the patient. And I don't think it's a good case to do the operation or painkiller. So if the patient is too old and we don't think the patient is good or is a good indication for the operation, even the patient cannot walk, I can do the walkway to show you the patient. This way, you know, cannot. He said, yeah, very difficult to walk. And the doctors think, consider he is too old to make operation. Oh, he can feel more than 95%. I can work easily. Alright. Some patients, we don't even think about operation. And like rheumatic arthritis. Please. You can see the patients becomes informal. Like this way, the first time.
是一位类风湿性关节炎的患者。侨居美国的他，
She has
因为
suffered
不
from
想获得
the
依赖药
rheumatic
物，
arthritis
多
for
年下
more
来
than
病情
10
日益严
years.
重，直到一个偶然的机会接触到了头皮针。
And not only pain.
10几年前开始，我的手已经开始扭曲，我变成外曲字形，
like
人家都是这样直直的，然后我是这样歪歪的。当我第一次来针的时候，我的2根食指是很痛的，好像第2次针完以后，我到现在为止它没有再痛过，没有再痛过，而且针完以后，我的手的灵活度是一次比一次灵活。
大脑如同人体的总司令，就西医的角度而言，它负责人语言、运动以及情绪
Not
的
only
学派。
deformity, but also very pain for more than 10 years. But you cannot imagine only one time. It means in a minute or in several seconds, when I do the acupuncture for her, her finger can move free only one time. So, do you think it's really amazing? And about 1 month's treatment, the deformity becomes normal and the finger free and no painkiller at all. So I think it's very, very good.
The treatment, you were like very painful on your back, and then after like he put needles in you felt better.
Within 10 years ago, I got an injury on my back, on my left side, and it was very stressful, very painful, uncomfortable throughout my years. And just today, after 9 years, I got it for the first time, an acupuncture, as you can see on my head. And right now, just from receiving these punctures or these acupunctures, I feel no stress or more relief than before.
Oh, yeah.
Thank you very much.
It's only one time of acupuncture. And
侦测显示就是3天前我被车撞到，然后就是尾椎有受伤，那连做都没有办法做。然后刚刚温医生就是帮我插了头针之后，我真的觉得太神奇了，我觉得好像没有感觉，好像回归正常了。真的太厉害了，好神奇哦。
because of traffic accident on the telephone contusion, so she cannot sit on the chair very easily. But only one time of acupuncture, she can feel free, 100% recovered. Some patient before operation, like this patient, he has suffered from right hip pain. He cannot perform hip abduction. This way, he cannot. But after acupuncture,
多久了？
before acupuncture,
8年了哈。
and after acupuncture,
什么厉害？
来再一次。
是啊。
你感觉怎么样？
不酸。
为啥？
yeah.
8年了吧，对不对？他在喝了整天。
After acupuncture, the abduction, he can perform freely. And the patient has suffered from AVN of femoral head for more than 1 year, and he came to my clinic on chair, and only one time of acupuncture.
左右边髋关节造血功能坏死。
好，那么拿了1年嘛哈。
对。
那我们针灸了几次，你变化怎么样？
第二次就已经那个没有拿拐杖了，也没有坐轮椅。
没有坐轮椅。
对，本来是坐轮椅。
感觉会很神奇。
有。很神奇。
走路我们看看。
好。
This was only one time of acupuncture. You don't need wheelchair or even stick. You can walk.
这可以的哈。
This is another AVN of femoral head, and the Taiwan University orthopedic department doctors strongly advise her to accept the operation because stage 3 to 4. But, so the patient came to my clinic with this way. She cannot walk normally, just this way, by cardboard. And then after acupuncture, the doctor said she can use this joint. We don't need to surgery and can maybe another 20 or 30 years.
一心，你说说看，你刚来的时候脚是什么情况？
刚来的时候其实有点跛，然后其实走路是会动的。
那时候台大有什么诊断？
他说至少要先做那个穿刺手术，叫减压手术啦，然后看可不可以不要那么痛。然后如果不行，
做了吗？
没做，那时候没有做。
然后他建议，
因为做了减压手术，一定要再换关节，这是很确定的。
他那时候说第几期
？MRI 左边是第3，然后 X 光是第4，然后右边是第1期。
哦，骨头坏死。
对对对。
好，那我们经过了这一段时间，大概有多久？
大概半年了吧。
半年嘛，哈。对。那么这一次在台大复检的时候，他怎么说？
他是觉得，因为我本来缺血性的那个区域其实比较大，那所以他应该以这种程度应该会塌陷比较快。
对。
但因为他现在塌陷程度还是外形还是跟去年半年前是一样的，所以他觉得也蛮特别的。所以他觉得如果按照这个程度这样都不动的话，其实这个关节还可以用20-30年没有问题。
哦。
所以他就不建议开刀，他就是先观察，对不对？因为他觉得自己的骨头还是比关节还是好用啦。
对，太好。那你起来走路示范一下，看看现在的状态。
现在就都还。
是
不是刚才
very
是不是我的感觉也都
and even go abroad
好的
visit Germany or America.
嗯。
And the patient has C56 herniated disc. His left upper limb weakness. He cannot reach out and get the ticket from the machine in the parking lot. But after acupuncture, he can even chop the frozen chicken.
停车卡都没办法。
对，是。
那今天我早上呢，我们那个大太阳光电的罗董事长送我一只烤鸡。
是。
我早上那只烤鸡冷冻的，我竟然我的左手可以来剁鸡，而且把鸡那么硬的骨头都可以剁断，把它分开。所以我觉得这个是我自己。
Okay, and this is a surgeon in medical center, and his parents brought him to my clinic, and he returned to work only 3 days.
张瑞宇，说说看你刚开始来的情况。
就是原本就有椎间盘突出的病史，那有一次就是突然的发作，那就是早上打个喷嚏以后就痛到立刻就是没有完全不能直立这样子，那时候是疼痛到就是腰都完全不能直立，完全不能站，而且连走路都不行。那在家人就是把我这样扛着来温医师这边做针灸。那一针完当下立刻呢，我就觉得疼痛度从10分降到7分左右。那而且立刻就是可以稍微撑着拐杖就可以站起来，跟稍微走动。那后来我在10天之内有做3次的疗程，那每次都进步很多，而且就是说回去的话也没有说再退步回原来的程度。那4天做了3次之后呢，第4天我就可以从10分疼痛度降到1到2分。
Return to work to be a surgeon after 3 days. Even post-operation, we can do some benefit for the patient, like this, with left femoral comminuted fracture, and the pain still bother him after acupuncture.
今天走来的时候脚很痛啊，
是
啊，不大能走啊。
是，现在呢？
现在一扎，感觉像刚起床这样子，不会痛啊。
10分的疼痛减掉了8、9分。
该算10分有。
哦，10分都按时啊。好，再说说看，说说看，没有。
And the patient cartilage regeneration procedure. After that,
你好，开完刀多久了？
开完刀5个月，现在。
好，那痛多久了？这件？
痛啊，痛到现在已经1年5个月了。
好，那么开完刀以后还是不舒服？
还是痛。
好，那本来的痛走路会怎样？
本来的痛要吃药，打皮下的针，再打血管的针，这样才能够过日子啊。
哦，
哎，
是，
才能过日子。那现在是不用打针了，可是还是痛啊。
OK。
跟以前比起来是好很多，但是还是痛。
那我们针灸一次，好，现在给你的感觉是怎么样？
好掉7、8分。
你可以走路看看。
I think one time of acupuncture, the pain release
就是髋关节嘛。
70 to 80%.
好。
现在不会痛。
非常好。
这请不要，但在以前没打啊。以前高家的，我天哪，不要的用没得，就没得一样。
对。
Before acupuncture, he cannot reach his toes. After acupuncture, he can easily reach his elbow. And the ultimate challenge is we have so many patients like this. He is esophageal cancer with terminal stage. He cannot swallow even anything, so this is, cannot swallow. So when he talk with me, he have to spill out his saliva. But after 5 times of acupuncture, he don't need to use cup. And 1 month later, he go back to work. So many time limit. So I would like to share with this my experience. I think acupuncture is going to be a new chapter in the medical history, and I hope I can make you feel interested in acupuncture. Thank you for your attention. Thank you.
It's my honor to stand here because Professor Wen is my teacher. It's 本当に素晴らしいですね. And it's very amazing needle. And because time is limited, to have anyone have a question or comment for my teacher, Professor Wen? Okay. I have a stupid.
Dr. Chen. All right.
Okay. Well. Okay.
It's very happy to see so many dramatic change and amazing cases. But I have some experience in acupuncture. I will ask Dr. Win. For example, such as femoral neck vascular necrosis. We use acupuncture. Some patients will improve and get acceptable, maybe dramatic effect. But the effect can be lasted for a long time. Maybe later 1 month, 2 months, then he suffer pain again. Then I try acupuncture again. Yes, I get some effect, but it's not so good. I will ask the question, how many percentage of the patient, for example, stage 3 femoral head vascular necrosis can be improved by acupuncture in your experience? I want to know the percentage. Maybe some patient I give him help, but others I have not this ability.
Thank you for your question. I think to answer your question, we need a randomized or a large control trial, like clinical trial. We still do the research in now, so I don't have the data to show you how many persons I can add. Okay, it's always need more research to see what condition is not acupuncture's indication. So I just want to share my experiences to don't forget acupuncture can help the patient just like this. Okay. Yeah. I really hope I got another opportunity to share my acupuncture with you.
Thank you. And that's
Thanks, Dr. Wen's amazing, fantastic presentation. I have one question. I think the acupuncture can improve the symptom side, but the morphology, especially the X-ray morphology, can improve, such as AVN or femoral head or OA knee. Thanks.
Like I show you the AVN, the girl, that case. Before and after, the doctor see no more destruction, no more collapse. So I think we prevent the disease worsening. Okay, and that make her can use the same joint for another 20 years. That's 台大医生就这么看的。那么 ，so morphology. We have another case. Cannot reach the ticket that one, and he can chop the chicken, chop the frozen chicken. That one you remember. After acupuncture, we cannot see the very obviously change in the X-ray, but symptom becomes this. The patient come to my clinic in this condition. 第一次来的时候是这样。After acupuncture, he can raise his hand freely. But from the morphology, X-ray, we don't see very much difference before and after. So interesting, right? So what happens? What happens? I think more research need to be done, or we cannot explain this very well. Okay. And I would like to say, I hope you learn the acupuncture skill and help the patients before it's too late. Yeah. Acupuncture is not everything. Acupuncture cannot cure everything, of course. But in the early stage, I believe it can help patients and prevent the patients becomes the condition need to operation. Okay.
Yeah, because time is limited and it's up. And my last question, a stupid question for my teacher. If you know the needle is good for patient, but patient fear the needle, what do you do next, my teacher?
All right. Everybody scared of pain.
Yeah.
Including me. A needle stick in the body is a little bit pain inevitable. But if you can make him better, I think the patients always accept. And that patient see this patient improve, and that patient accept. That's the way we are. Okay? Yeah. No other way to tell him to say, oh, no pain. No, we cannot say the word like this. It's okay, it's a little pain, but I can help you. That's what I do.
Thank you very much.
Thank you very much for Dr. Wen's presentation. On behalf of the Taiwan Orthopaedic Association, I now present this souvenir to him as a token of appreciation. Thank you. Thank you.
One, two, three. Smile. One more. Okay, good. 好，谢谢，好的，谢谢。